Hello, my name is Stuart. I am a nurse practitioner student at Youngstown State, and I am here to see you about your health history. Okay, so tell me, what is your full name?
My name is Margaret Howard.
And do you go by Margaret or do you go by something else?
I go by Maggie.
All right, can I call you Maggie? Is that okay?
Absolutely.
All right, tell me what brings you in today.
I've been having some ear pain, my left ear, for about 5 days.
All right, can you tell me, you said it started about 5 days ago. What makes it better?
I've been putting like a little cotton ball inside the ear, kind of helps with, I guess, some pressure.
Okay, and can you tell me what makes it worse?
I feel like after I take a shower, I feel like it gets worse. Sometimes just laying on it makes it worse.
Okay. Has this happened before?
Yeah, it's happened in a long time ago.
Okay. Has it changed since it actually started?
No, it's about the same. It's just been ongoing for like 5 days.
All right. Can you describe the pain to me at all?
It's a very dull pain.
Dull pain. All right. And have you taken anything over the counter for this at all?
I have. I've taken some. I take like Zyrtec every day. I use the nasal spray. I can't think of the name. I think it's just saline spray. Just some like saline spray in my nose. Some Zyrtec and some Tylenol if I need it. If it's really uncomfortable.
Okay. Have you, do you have any other symptoms that go along with your ear pain, such as sinus congestion, sore throat, runny nose?
Yeah, a lot of sinus congestion. No sore throat, but just like a lot of sinus pressure. Yeah, that's it. Sometimes some like postnasal drip.
Okay, so I am just going to ask you just about the rest of your health, just so I can get an overall history. Okay.
Okay.
So let's talk about your family. Has anyone in your immediate family had any heart disease, high blood pressure, cancer, stroke, anything like that?
Yes. So my mother had a history of major stroke.
Okay.
She's had high blood pressure, diabetes, obesity. I think that's about it on her side. My dad had a history of diabetes, obesity, high blood pressure, and then stomach cancer.
Okay.
And I say they both have since passed. They've passed away. And then I have a brother who also has passed away, and he had a history of leukemia.
Okay. Let's talk about your past medical history. Okay, so in your childhood, have you had any of the childhood illnesses such as the measles, the mumps, chickenpox, anything like that?
I did. I had chickenpox when I was about 5 years old.
Okay. And do you, in the past or now, do you have any diabetes, hypertension? Have you ever had a stroke?
I do not have any of those.
Okay.
No high blood pressure, no diabetes.
All right. And then while you were growing up, your immunizations, did you get all your immunizations such as the MMR, the Tdap, those things?
Yeah, as far as I'm aware, yep, I've been up to date with all immunizations.
All right. Did you get your flu shot this year?
Yes, flu shot. I'm up to date with my COVID vaccines. Yeah, that's what I had this year.
All right. Have you had any unusual skin reactions to any of those vaccines that you
None.
recently had?
No.
All right. Have you had any surgeries?
Yes, I've had a history of sinus surgery. I've had my appendix out. I've had my tonsils out. I've had surgery on both my right and my left foot.
All right. Sounds like you've had a lot of surgeries.
Yeah.
What type of medications are you taking?
I only take a probiotic every day and then a multivitamin. And then occasionally I'll take the Zyrtec. Like I've been taking that since I've been having the ear pain. So some Zyrtec and Tylenol or ibuprofen as needed.
Okay. So nothing prescribed from a doctor then?
No.
Okay. Are you taking any other home remedies such as non-prescription? I know you said your ear was hurting you. Are you taking anything else besides the ibuprofen or anything like that?
No, just ibuprofen, Tylenol, and I've been doing some like warm compresses with like Epsom salt soaks on the outside, just behind the ear, just to see if it'll help. I don't know if my ear needs to drain or what's going on there.
Okay. Do you have any allergies to any medications?
I'm allergic to oxycodone. Found that out after having all these surgeries.
And what happens when you take oxycodone?
I get a really bad rash with a lot hives, rash with hives.
Okay. Do you have any environmental allergies at all?
Not that I'm aware of.
Okay. Have you taken any recent screening tools such as cholesterol, a mammogram, colonoscopy, anything like that?
Actually, yeah, I've had a colonoscopy about 3 years ago due to my dad's history of stomach cancer. They try to make sure I'm up to date with that. I get a yearly mammogram, routine GYN visits, pap smears, all those kinds of things are all up to date.
Okay. And is there any emotional disorders or any psychic problems that you have that we should know about?
No.
All right. What is your highest level of education?
I have a master's degree in nursing.
Master's in nursing. And what is your marital status?
Married.
Married. How long have you been married?
25 years.
And how many hours would you say you work in a week?
Between 50 to 60 hours.
All right. Do you drink alcohol?
I do.
How much would you say you drink in a week?
I probably have 1 to 2 glasses of maybe wine a week.
Okay. Do you smoke cigarettes at all?
No, I don't smoke.
Are you sexually active?
Yes.
Are you practicing safe sex?
Yes.
Are there any concerns for any sexually transmitted infections?
No.
Have you now or ever been in the military?
No.
Do you exercise at all?
I do.
How much would you say you exercise in a week?
I try to do 30 to 45 minutes at least 4 to 5 days a week.
Okay.
I have a treadmill and a spin bike.
So you run and spin 4 to 5 times a week.
I do.
All right. I'm just going to go over just a general systems of you, just so I can get a better history of how your whole body is actually doing. Okay. So have you ever recently have you had any weight loss, any fever, any chills?
No.
What about your vision? Have you had any double vision, redness? Do you wear glasses or contacts?
I wear glasses and contacts, and then I have routine. I see my eye doctor every year, so really no major changes.
Okay. And what about your? Oh, you already told me about your ear pain. So, what about your other ear? Any ringing? Any hearing loss?
No.
Any sinus congestion? Any sinus pain?
I do have sinus congestion. Like I said, I had sinus surgery, but I always have like chronic sinus pressure, congestion.
Okay. Any mouth sores? And when's the last time you saw your dentist?
No, nothing. No mouth sores. I don't get any cold sores or anything like that. And I do see my dentist every 6 months.
Okay. Any chest pain, any shortness of breath, any high blood pressure at all?
Nothing.
All right. Let's go into respiratory. Have you had any cough, shortness of breath, any wheezing?
No.
What about, have you had any abdominal pain, any heartburn, any changes in appetite?
I do have heartburn, chronic heartburn.
Okay.
I guess I should say I'm not on prescribed medication for it, but I do take Tums as needed.
Okay. Any frequent urination, any urgency, any vaginal discharge?
No.
Have you had any muscle pain, any joint swelling, any joint replacement surgeries?
No joint pain, but I do have chronic foot pain.
Chronic foot pain. In which foot? Because you said you had surgery in both your feet.
My right foot, I have chronic pain. My right foot was the worst. I broke it, had surgery, had hardware put in, hardware taken out, so that my right foot is right worse. But
Okay. Sounds like you know when it's gonna rain.
I do.
Any skin issues such as rashes, sores, blisters, any kind of growth?
No.
No type of itching or anything like that?
No.
In your right foot, have you had any numbness, tingling, or burning sensations?
I do. I have chronic loss of sensation where the incisions, incisional pain, and I believe they even cut one of the nerves in that foot, so I think that's why I have a lot of chronic burning and pain in my right foot.
Have you had any of those same symptoms, the numbness, tingling, loss of sensation, or burning in any other part of your body besides your foot?
No.
Okay. What about any depression, any feelings of hopelessness, any thoughts of suicide?
No.
All right. What about any excessive thirst, any unexplained weight loss, any heat intolerance?
No.
What about any excessive bruising, bleeding, any blood disease or anything like that? Because you did say your brother had cancer, right?
Yeah, no. I've had very, very thorough lab work and follow up just based off of my family history, and I don't have any of what everybody else has.
Okay. And you told me that you did not have any allergic reactions to any immunizations, but have you had any other type of allergic reactions? Any eczema, any environmental allergies that you know of?
No.
All right. What do you feel about your overall health?
Oh, I feel like I'm in pretty good health. I mean, I'm very active. I stay busy working, but I have a good work-life balance with work, family, kids.
Okay. And what do you do as a hobby? What do you do to enjoy life?
When I'm not working, I like to hang out with my family, go on vacations, hang out with friends.
Okay. Did I miss anything about your history that you would like to tell me?
I don't know if this is important, but I do have 4 kids. So that's the only thing else that's part of my family that I haven't discussed.
And your 4 kids are all healthy and not have anything, your diseases or anything like that that your parents
All
had?
my kids are healthy to this date.
Good. All right. So you did come in today. You had your left ear pain. It's been going on for about 5 days. Your mom and your dad had high blood pressure and diabetes. Your dad had stomach cancer, and your brother also had leukemia, which is another cancer. And you do see your eye doctor and your OBGYN and your dentist regularly, and you've gotten all your immunizations, okay? So I would just like to thank you for coming in today.
All right, thank you.